our Friends Over 50, which is our Thursday morning program for seniors, for older adults. Each week we have breakfast, and we have a different speaker on a different topic each week that interests you. We're trying to connect you with all the resources in the community available for you. Good morning. Nice to see you. But this week is a very special Friends Over 50. Today, our friends from the Prevention of Blindness Society of Metropolitan Washington are here, and also from See Clearly Vision are here. Our speaker is an ophthalmologist, Dr. Katie McCabe, and she's going to talk to you about keeping your eyes healthy as you grow older and some of the issues that you have with aging eyes. That alone will be terrific information, but when she's finished, at noon today, we have a special extension. So from noon until 3 o'clock today in the library, we will be offering free visual acuity screenings and glaucoma screenings. So vision screenings and glaucoma screenings. And we'll also have reading glasses available to you for free as well. So these are not prescription glasses. They're like the magnifiers that you might buy in the drugstore. But you don't have to buy them here. They're available to you for free from our friends at Prevention of Blindness Society. If you did not sign in at the table when you stepped in, please make sure that you sign in. And if you do want to stay for a screening or for reading glasses, you need a numbered ticket. And you can get that ticket at the table as well. And what we're going to do once we get settled after the talk and our screeners are ready is we'll still start calling those numbers. Okay, and they're just going to go in the order that you came in. They're just right in sequence. The screenings take about 5 minutes. So if you're way down the list, don't be discouraged, okay? We have this program every Thursday, so please share with your friends. Let them know if you're on social media. Let them know on social media that you're here. If you're on social media, you can follow DAH Social Services, D-A-H, like Dar Al-Hijrah Social Services page, and you'll get all of our flyers and program and class and event information. That's a great way to follow what's happening. And there's a lot happening. There are 4 or 5 programs just today. We had our food bank distribution this morning. We're having our speaker and then our vision screenings. Our sewing students are doing an installation today, and we have our nutrition class this afternoon. So it's busy in social services. So follow us on social media, and also follow Dar Al-Hijrah YouTube channel. Yusuf records all of our sessions, so if someone is homebound, if they're older, or they don't drive, or they have little kids and they can't come in, they can watch all these sessions from home on our YouTube channel. So you can follow that as well. We get as many views of the sessions on YouTube as we do people who actually come to the sessions. So share that with your friends, your family, your neighbors, anyone that you think may benefit. Okay? So welcome again. I'm going to turn it over to Dr. Katie McCabe, and she's going to get started here in just a minute.
Oh, hi. I'm Katherine McCabe. I'm here from See Clearly Vision. Thank you, Stacy, and thank you for hosting me today. Excited to speak with you this morning. So I'm here from this area. I was born in Annandale, so very close by. I went to University of Virginia for my undergrad, and then I went to just over to Richmond to Virginia Commonwealth University for medical school. I did my first 2 years of medical school there in Richmond, and then I actually spent my second 2 years at their second campus at Fairfax Hospital, just around the corner. I did my internship in internal medicine at Maimonides Medical Center, which is in Brooklyn, New York. And then 3 years of ophthalmology residency at New York Eye and Ear Infirmary of Mount Sinai. And then I've returned here. I live in Arlington now, and I work at See Clearly Vision as a general or comprehensive ophthalmologist. Okay, so I know a lot of people are very nervous about going to the eye doctor. No one likes the idea of something touching their eye or bright lights in the eye. So the good news about ophthalmology is most vision problems can be cured, improved, or prevented. So that's what's really great, as opposed to a lot of, chronic conditions that just gradually get worse over time. Many things in ophthalmology can be improved. So that's what we like about ophthalmology. That's why I went into ophthalmology. The bad news related to ophthalmology is some serious eye problems are not apparent. You don't have very severe symptoms until the condition is very advanced. So regular screening is essential to try to prevent those things. Okay, so one of the most common things, and I see a few people with reading glasses in the room, is called presbyopia, which is just the Greek term for aging eye. So this happens to all of us over time. We can no longer adjust our eyes from far away to near. Or as some people joke, as in this picture, maybe your arm's just not long enough to hold the book far away from you anymore. So again, this happens to all of us. If you're naturally nearsighted to begin with, some people can just remove their normal distance glasses and see up close, so you may notice that as well. So what can we do about it? As you know, you can use reading glasses, and a lot of people wonder whether the over-the-counter drugstore reading glasses work, and they actually do. They can work quite well, and we have some available today and after your screening. So that's one option. However, if you also have a distance prescription, you can consider progressive reading glasses that you wear all the time. The top part is for the distance, the bottom part for reading, or a bifocal, same idea. And we actually make contact lenses as well. So if you don't like wearing glasses all the time, there are contact lenses that have prescription for both the distance and reading. Okay, so cataracts is another common condition. You may have heard of it from friends or family who have had cataract surgery. And what it is it's not something new growing in your eye. It's the natural lens that we all have inside of our eye. It focuses the light on the retina. The retina is the inside lining of the eye that takes all the light information and interprets it and sends it to our brain. So that natural lens can cloud with time, and then we rename it a cataract at that point. It's natural. It happens to all of us. It's not a disease. We all can get it. But they can form early in some people. If you have diabetes, the cataracts come a bit early. If you've had an injury to the eye, you can develop a cataract even immediately after the injury or over the next few years, which is asymmetric. The other eye might not have a cataract, but the one that had the injury can. Use of steroids, either steroid eye drops for an eye condition, or if you take steroids for asthma or other conditions, that can give you early cataracts as well. If cataracts come early in your family, they may come early for you too. And exposure to the sun over time also leads to cataracts. So when it's very bright outside, we do recommend wearing sunglasses with UV protection. Okay, so what are the symptoms of the cataract? How do you know that you might have one? Blurry vision is, of course, the main one that you notice. Another kind of interesting thing is as the lens becomes cloudy, it actually focuses the light a little bit differently, and it can change your prescription. So if every year your glasses seem to be changing a lot, that can be a sign of a cataract as well. Because not as much light is getting through that lens, you may notice that in dim lighting conditions you can't see as well as you used to, or you could get glare. So if you have a very bright light, a lot of people especially describe it with bright headlights on the road, you really have a sharp reduction in your vision. The cataract typically is a little bit of a yellow or brownish color. So gradually, color perception may change as well. A lot of patients notice after they have one cataract removed that the colors are totally different one eye from another. And many patients, especially artists, really notice that. So that's one thing that can improve significantly after surgery. Okay, so I have a question for you. There's no problems if you get it right or wrong, don't worry. So, true or false, can cataracts be removed entirely by a laser? I don't know. Any guesses? Yes? I know most people do think so because it's advertised heavily, laser cataract surgery. But we actually can only do laser for part of the steps of cataract surgery. You do always need to do a real surgery as part of it, but that doesn't mean it's something to be nervous about. We use very, very small incisions on the eye. They're so small we don't even have to close them at the end of the surgery. They close on their own. They're so tiny. And we use ultrasound energy to break up the cataract and remove it from the eye. But the laser can make it a little bit more precise, but that's one thing that is just kind of a common misconception, that you need to have a laser to remove the cataract. Okay, so what do you expect? Obviously, the prospect of surgery on your eye can be a little bit scary, but I don't want you to be too worried about it. Especially compared to any other surgery, it's quite painless. It's an outpatient procedure. You don't have to spend the night at the hospital. It's done one eye at a time, just for safety reasons. We want to make sure one eye fully heals and you can see well out of that eye before we operate on the second eye. It's actually not done under total anesthesia. You're slightly awake for it, but you may not remember because there's a lot of sedation, medication, and of course the eye is totally numb. You're still breathing on your own. You can talk to us during the surgery. So people sometimes say funny things during the surgery, which I enjoy. But it's very quick. It's 10, 15 minutes, half an hour. It's not a very long surgery, and then you get to go home later that day. And then we see you one day after surgery, a week after surgery, a month after surgery, and you use eye drops, antibiotics, and anti-inflammatories afterward. It's up there. Okay, so after we remove the lens from the eye, the natural lens, you still need a lens in the eye to focus the light on the retina. Otherwise, your vision will be extremely blurry after the surgery. So actually, almost all patients get an artificial lens implant in the eye at the end of surgery. What's nice about that is if we're going to put a lens in your eye, might as well put in your glasses prescription into that lens. So many people who've needed glasses for the last 60, 65 years no longer need glasses anymore because we can put that prescription into the lens implant. So we tailor the surgery to you and your eye. They actually are making now a specialty lens implants that adjust for both far away and for near. So, it's actually kind of a nice upgrade for some people after cataract surgery. Okay, so next up, I wanted to speak about glaucoma. Glaucoma is a very serious one, and it's one we'll be screening for today because this is one of those conditions that doesn't have symptoms until it's quite advanced. And unfortunately, vision loss from glaucoma is not reversible. So catching it early is essential, and there are things we can do to prevent it from progressing. So what is glaucoma? It's damage to the optic nerve. The optic nerve is the cable that connects the eye to the brain. So if there's damage to that, not all of the signal of the things that we see every day are getting to our brain. And specifically in glaucoma, the side vision, your peripheral vision, is affected first. And that's actually why a lot of people don't even notice it until it's very advanced, because it's not like it's a black cloud, it's more just that vision's missing off to the side, and you kind of adjust to it because it's coming slowly. But we don't want you to lose any vision. We want to catch it as early as possible and stop it in its tracks. There are two types of glaucoma. I wanted to tell you about them because we treat them each a little bit differently. The most common type is called open-angle glaucoma. It's very slow, it's very gradual, and it's painless, which is nice, but at the same time, then you don't know that you have it. But we can catch it. So we catch it early just with any general eye exam where we dilate the eye, we check the pressure, and I think today we'll be doing visual field screenings as well, which is another way to check for glaucoma. But again, like with all glaucoma, at this stage, we haven't invented a way to bring back vision loss from glaucoma. So we like to catch it early and stop it from being a problem for you. The other type is called closed-angle glaucoma. This happens where the drainage structure of the eye, the part where the fluid drains out of the eye, closes shut. And then the pressure in the eye shoots up very high all of a sudden. That can be very painful. Typically would happen in one eye. It would get very painful, the vision would be very, very blurry, and the eye would be very red. So you would know right away, and you should come to see an eye doctor to check. But patients who are at risk for having that, we can actually catch on exam as well, because there are certain features when we look at your eye that tell us that you're at risk for this type of glaucoma. And then just with a fairly small in-office laser procedure, we can prevent that from happening to you. So that's one thing we can do. So here's just examples of what the vision looks like in glaucoma. What does it mean? How can you tell? So normal vision here, you can see in the picture, you can see all the way out to the sides, good peripheral vision. In early glaucoma, the most common spot is kind of here towards your nose in each eye, and then kind of off to the sides here. And then as it advances, it can become kind of like a tunnel vision. So someone can be 20/20 walking around with great central vision, but not see anything off to the sides, which would be very hard to drive and to do your daily activities with that kind of vision. So we want to catch it when it's early and prevent it from advancing. Okay, so who's at risk for glaucoma? Who needs to make sure that they're getting their screenings regularly? If anyone in your family has glaucoma, parents, aunts and uncles, siblings, you should get screened for glaucoma as well. High eye pressure is one of the biggest risk factors for glaucoma. But the problem is this isn't a pressure that you feel usually. So you have to check it, have to get that eye pressure checked by an ophthalmologist or an optometrist, and they will tell you if your pressure is high, and then we can start to treat it. An old injury to an eye can actually cause glaucoma as well, because it can scar that drainage area of the eye where the fluid drains out, and then the pressure gradually goes up, and many people don't even know because it's just in one eye. You start to lose vision off to the sides. So if you've ever had a very bad injury to an eye, you should also get checked for glaucoma. Put a picture of a tennis racket there because that's a common offender. You're playing tennis and the ball comes and can hit the eye. So and like a blunt trauma to the eye can cause it. Another one is age. The more birthdays you have, the more likely you are to have glaucoma. So as we get older, it would be good to check for glaucoma as part of your general eye screening check. And again, steroids are another culprit here. If you have asthma and have to use steroids frequently or other conditions that need steroids, just like it can make you have early cataracts, it can also give you glaucoma, so we have to check for those things. Even steroid eye creams used for like skin conditions around the eye, they can get into the eye too, so it's good to check. And then lastly, diabetes. There's two types of diabetes that can cause glaucoma. You can either just have the open angle type, and you're at a slightly higher risk for that with diabetes, or with very, very advanced diabetes of the eye, you can get the closed angle type. So if you have diabetes, it's also worth getting checked for glaucoma. Okay, so this is one of the ways that we check your eye pressure, and I think this is one of those things that makes people a little hesitant to go to the eye doctor, because I know that looks very scary, right? Having something come towards your eye. But this device here we use on babies. It doesn't hurt at all, okay? So it's nothing to be nervous about. There's a lot of different ways we can check the pressure, and we want to make you as comfortable as possible. Normally, when we do it, the eye's totally numb. Just with a numbing eye drop, we check the pressure. People don't even realize it happened. So nothing to worry about. We can check your pressure. Okay, so what if we tell you you are at risk for glaucoma, or we think you have early glaucoma? The first thing we do is eye drops. One of the main drops we use is just one drop in each eye in the evening. So it's not a huge inconvenience. So if you find out you have glaucoma, you want to know early and treat it with something simple like this and make your vision, prevent your vision from getting worse over time. Laser procedures can be done both for the closed angle type and the open angle type. And again, this is something we can just do in the office. Just takes about 15 minutes or so. And then lastly, for very advanced glaucoma, there are surgical procedures that can be done as well. One kind of neat thing that's on the horizon here is something called minimally invasive glaucoma surgery. So if you see here, this is a penny, and on the penny you see those tiny little dots. And when they're highlighted, those are actually little stents that can be placed in the eye at the time of cataract surgery. So it's not even an additional surgery. You would have no idea it's happening. It just takes an extra few minutes at the end of surgery. And it can reduce your risk of glaucoma. If you have high eye pressures, this can help keep the pressure lower without drops. So that's another thing that's kind of exciting. Okay, macular degeneration. Has anyone heard of macular degeneration, or anyone in your family with it? Yeah. So what is it? So it's progressive damage to the central part of the retina. The retina is like the film of the camera of our eye, the inside lining of the eye. And unfortunately, with macular degeneration, it's in the central part of our eye. And so that affects our central vision. Okay, so up above here you see just a normal photo of a family, and then to the side you see how macular degeneration can affect your vision. It can affect the central vision, unfortunately. What you see below is called an Amsler grid. It's just a piece of paper. It's a way for you to screen yourself for macular degeneration. On the left-hand side, you see the grid that looks straight. So the idea is you look at the dot in the middle of the grid, and then make sure all the lines still appear straight. And so that's why it looks normal on the left. But on the right here, this simulates what someone might see if they had macular degeneration. The lines are all becoming wavy. And that's because the retina is kind of wrinkled there, so then your vision is kind of wrinkled in that spot. Okay, Okay, so who's at risk for macular degeneration? Again, this is another disease that comes with more birthdays. The other name for it is age-related macular degeneration. So with time, you should check for macular degeneration on these routine eye exams as well. Smoking is another big risk factor for macular degeneration, and that one, is something we can change. So if you smoke, it's something that, if you reduce the amount that you smoke or eventually quit, it's good for all parts of the body, but it also can help prevent you from developing macular degeneration. If it runs in your family, you definitely need to get checked for it. This is another thing similar to cataracts where sunlight can affect your risk for it. So if you're out in the sun a lot, especially if you're from somewhere on the equator or visiting family somewhere on the equator, you want to wear sunglasses with UV protection. Diet has also been shown to affect your risk for macular degeneration. I was looking online, they make cookbooks for patients with macular degeneration that are high in the vitamins that have been shown to help slow the progression of dry macular degeneration, which we'll get into in a second. And then high blood pressure. So seeing your primary care doctor, making sure your blood pressure is under control, also lowers your risk for this. Okay, so there are two types of macular degeneration. There's the dry type, which is the most common, where the retina, the central part of the retina, becomes thin as we age, and then deposits form underneath the retina. So what do we do for this? Unfortunately, at this stage, we can't reverse it, but we can help prevent it from getting worse. So that's, again, another thing where we like to catch it early. They make vitamins specifically for macular degeneration called AREDS, AREDS2. And if we think you may have it, we would, write down the name for you because it's a little bit of a mouthful. But they are high in antioxidants and other vitamins that have been shown to slow the rate of progression of macular degeneration. And again, sun protection. For wet macular degeneration, it's a little less common, thankfully, because it's a little bit more serious. You can lose your vision very quickly. You can, be seeing pretty normally, and then all of a sudden in one eye, it becomes very, very blurry centrally. And the reason for that is that abnormal blood vessels are growing underneath the retina, and then these abnormal blood vessels can leak, and then fluid is getting out underneath the retina and causing severe vision changes. The good news about that is there actually is a treatment for it. It's called Avastin, or there's other medications in that same category. It's actually an injection, unfortunately, but that can bring back a lot of the vision that is lost from wet macular degeneration. So there's good news with that you can bring back that vision and make the eye functional again. Okay, so how do we check for this? So again, on a routine eye exam, we're always going to check you for macular degeneration. When we dilate your eyes, which means we put in drops that make your pupils very large, and that is our window to look into the retina. That exam is a little bit annoying because it makes you very sensitive to the light for a few hours afterwards and makes things a little bit blurry, but it is important to do that at least once a year so that we can check for this. If we have a suspicion that you may have macular degeneration, there's a tool called OCT, and it just uses light technology, it's not invasive at all, that shows us the layers of the retina, like in this picture here. So these little kind of bumps that you see underneath the retina are called drusen, and that's a sign of macular degeneration. So, and we have that in our office, and many ophthalmology offices have that test available. Okay, so dry eye is a very common one. Does anyone here experience dry eye? Yeah, it's very common and very annoying. So I have another question for you, because you may be experts since you have it. So dry eyes are often tearing or watery. Is that true or false? Can dry eyes be watery? Any thoughts? Yeah? So it actually is true. It's actually one of the most common causes of watery eyes, which sounds kind of counterintuitive. But the reason for that is when your eyes are irritated, as like when you get with dry eye, they cause reactive tearing, where the eye's just kind of pouring tears, and it's not good lubricating tears that really help the surface of the eye. They just kind of pour down your face. So it's a little bit of a surprise sometimes that watery eyes can be from dry eye. Okay, so the symptoms of dry eye are actually quite variable. One is burning. So if you have, that feeling you get if you're walking around outside and it's cold wind blowing into your eyes and they really sting, that can be a symptom of dry eye. The next most common thing is the sensation that something's stuck in your eye. A lot of people say, oh, there's like a piece of sand or something stuck in my eye. And that's often actually dryness because the surface of the eye is very irregular, kind of bumpy. So as you blink over it, it feels like something's stuck in your eye. Fluctuating blurry vision. So if your vision improves significantly when you blink, that can be a sign of dry eye as well. Because when you blink, you're moving new tears over the surface of the eye and smoothing the surface that you are looking through. So if your vision is changing a lot and improves when you kind of blink, that's also a sign of dryness. Sensitivity to light is a very common one. And then redness. If your eyes are kind of chronically like a little bit red, a little bit irritated, that is most commonly dry eye as well, although it could be many other things that we could check you for. All right, so what do we do for dry eye? You've probably seen these before in the drugstore. Artificial tears. They're the most common first step that we do for dry eye. Refresh and Sustain are very common brands, but again, there's numerous brands that you could use. If your eyes are very sensitive, they make preservative-free type. And if you wear contact lenses, they make a separate type for that as well. So there's so many different types there, we could find the perfect one for you. Okay. Another common cause of dryness in the eye is actually clogged oil glands at the edges of our eyelids. We need oil in our tears so that it doesn't evaporate right away. And that oil is produced by these glands here in the picture. They're called meibomian glands, and they produce the oil component of our tears. Many people have clogged meibomian glands, which sometimes can lead to bumps on the eyelid, but also causes dryness on the eye. So the best treatment we have for that is using heat, because the oil gets kind of thick there in the gland, and we want it to open up and to flow onto the surface of the eye. So you can use warm compresses. You can usually, the simplest thing would be just at home with a washcloth and hot water, putting it over your closed eye for about 5 or 10 minutes. Another kind of easy thing is they do make eye masks that you can throw in the microwave for a few seconds to warm up and then put on the eye. What's nice about that, it's not wet, it's not dripping down your face, but you can just use a washcloth as well. And that it doesn't end there. We have numerous treatments for dry eye, and that's one of the things we specialize in at our clinic as well. You can do punctal plugs, which are actually little tiny microscopic rubber stoppers that we put into the tear drainage canal in your eye. We just do it in the office. That keeps your tears on the surface of the eye longer so that the eye doesn't get dried out. There are medications, one's called Restasis and another one called Al-Hijrah, that are anti-inflammatory eye drops that can help with dry eye. You can take supplements that have been shown to help with dry eye. And even actually just using a room humidifier can really help too, because if you think about it, in the winter, things are already quite dry in the air, and then we turn on the heat, and it dries out even more. So some people actually benefit from having a humidifier in their room. Okay, so one of the biggest avoidable causes of vision loss and very severe vision loss is vision loss from diabetes and high blood pressure. So what is it? How does it affect our vision? So when we have diabetes or high blood pressure for many years, it can damage the very, very delicate, tiny blood vessels in the retina. Again, that's that very delicate layer at the back of our eye that transmits information to our brain. When these blood vessels are damaged, they can leak in the retina. You can get blurry vision just from the fluid leaking out, or you can get large bleeds inside the eye that obscure your vision. So here's an example of vision if you had swelling in the retina related to diabetes or high blood pressure. So again, just a normal photo on the left, and on the right, you can see it's all a little bit wavy and distorted. And then if you did get a bleed inside the eye, suddenly the vision can be dark, or you see kind of a dark cloud in your vision in one eye. The good news is that usually reabsorbs and goes away. That's not permanent, that your vision would be changed by that blood. Usually your body can reabsorb it, but that's just a sign that diabetes is affecting the retina, and you would want to get that checked. The most important thing is, of course, preventing it. So if you see your medical doctor regularly and keep the diabetes and high blood pressure treated and under control, Our hope is this would never happen. But some people, it's very difficult to control diabetes and high blood pressure, and it can run in your family, and you're doing everything right, but your diabetes can still have high sugars. So if that's the case, we do recommend seeing your eye doctor every year to dilate the eyes and check for this. Because just like many other eye conditions, the earlier we catch it, the better it is, and the better vision you will have. Okay, so how do we treat it? There are in-office laser procedures that can be done for more advanced diabetes in the eye, and there's also injections that can be performed, which again sounds scary, but it can really bring back your vision. If you've lost a lot of vision from diabetes, a lot of times we can improve it significantly with these medications. And we want to keep these things under control because blurry central vision is bad, occasional bleeding in the eye is bad, but what causes true vision loss is if you were to get a retinal detachment related to scarring in the eye or advanced glaucoma from diabetes. So again, we want to catch it early and make sure these things never happen to you. Okay, so I'm happy to take any questions now, and then I'll have some questions for you. So what questions do you have for me? Anything I can answer? Yes. It's a great question. So cataract surgery can be laser assisted, but you don't have to have the laser in order to remove the cataract and have a successful cataract surgery. But it does make it a little bit easier so that the risk of complications is lower, but it's not essential. So you can still get the same great vision without a laser as well. Now, maybe what you're thinking of, sometimes once you've had cataract surgery, you can get a little haziness on the back of the lens implant, which we kind of clean off with the laser in the office. So that would be a procedure performed after cataract surgery to help clear up your vision. I know. I know, exactly. A lot of the commercials do mention the laser. That's why I brought it up. You're exactly right. Do you have a question? Yes, so if you're... Yeah, so I would say most ophthalmologists do check this every time. If you're going in and they're going to be dilating your eyes and doing that whole test, they most likely have checked your pressure as well. Yep, exactly. If you're just going to a place that is just doing your glasses or contacts and is not doing like a health of the eye exam, they may not. But any kind of full comprehensive eye exam would check for it. You can specifically let them know, but they probably will anyway check for it. Yeah. Yes, ma'am. So immediately after surgery, typically you'd go back the day after surgery, a week after surgery, and a month after surgery. And then we do 2 eyes. So then the same process for the other eye. You would still want to go, once you're out of that time that's right around the surgery, I would still recommend going once a year. Because you're done with cataracts now, so that's good. But you'd still have to get checked for glaucoma, macular degeneration, that sort of thing. So you can go back to annual, yearly screenings after surgery. Yeah. Yes, ma'am. No. They can take some time to get adjusted to. I don't know if that's something you experience. Some people don't love it at first because as you move your head, the prescription changes. You have to get a little bit adjusted to that. But no, it doesn't damage your eyes. Yep, great question. So bifocal has that line. So above the line is one prescription, below the line is the other one for the reading. For progressives, it's a gradual change from up above to the bottom. So up above is the distance, the bottom is for reading. But a lot of people in the modern world are working on computers, right? Which is kind of in between distance and reading. So what's nice about the progressives is some of that middle range can work well for kind of this distance as opposed to this distance. So that would be the added benefit of progressives. Yeah. Oh, or versus 2 eyeglasses, neither one's better, as long as you don't mind taking them on and off. Yeah. Now, what's nice is if you have 2 pairs, the full glasses is for each prescription. So that's what's kind of nice. But no, either one is fine. Yeah. Yeah. Yes, ma'am. To lose your sight from a laser eye surgery? Well, that's a great question. So we use the laser for so many different things in ophthalmology. We use it with cataract surgery. We use it for glaucoma. We use it in LASIK. That's probably the place you've heard it the most because that's advertised a lot. So the risk would all be different depending on each of those things. I would say, generally speaking, the lasers we use are very safe. I know, no, it's very scary, right? A laser's pointed at your eye. I actually got LASIK myself, and right beforehand, I was like, what am I doing? I'm getting a laser right at my eye. But it went great. Don't worry. So they're extremely safe. Yeah. We use very specific wavelengths, and they're very, very precise. They're more precise than humans are, so we like them. Yes, ma'am. Yes. Yes, so for each person, it's very different. Some cataracts take 10, 20 years to develop and get worse. Some get worse over the next year or two. Yeah, so usually the cutoff that we use, at least the cutoff for insurances when they cover cataract surgery, is 2040. So once your vision, so on the eye chart, 2020 is really, really good, 2025 is pretty good, 2030 is pretty good, but 2040 is kind of middle. And once your vision is that blurry, then we consider cataract surgery, and that's when insurance would cover it. Yes? You see like a little light? Yeah, so that's not from the cataracts. Those are two different things. You can get flashes of light in your vision. That's a great question. So if you ever see in your vision bright flashing lights, like a camera flash, especially like at night, people notice that and it's like, where is that coming from? Or if you see lots of new dark spots in your vision, it's normal to have a few floaters, a few kind of dark things when you're looking at a bright background. But if you see flashing lights or many new dark spots, you'd want to get a check of your retina. A few floaters, it's okay. We all have them. But if you get many new ones all at one time, you would want to get checked because a flash tells us that something's tugging on your retina. Because when there's force on the retina, it transmits as light. So that may be what it is. So if you have that, you want to check. It may be nothing. It just may be that gel in the back part of the eye called the vitreous moving around. And that's okay. It's not dangerous. Yeah. Yep, and it can often be on the side. So if you have that, it's good to get checked to make sure the retina doesn't have a tear or hole in it. Yeah. Yes, sir. It doesn't. Because you mean for your reading glasses? Yes, sir. So it depends on where you hold your reading material. If you're holding it very close, you might need 3. If you're holding it here, 2. So that's okay. You just have to hold it in a different spot. Yeah. Yeah, and as we get older, so like let's say if you're 45 and you're just starting to need reading glasses, you need a smaller number, +1, +0.75, but over time you may need more. So that's normal for it to change a little bit, where you start to need +250, +3. Baby aspirin has not been shown to affect macular degeneration. It helps for other things. I know certainly internal medicine doctors use it for other things, like for our heart or for stroke prevention, but it hasn't been shown to make macular degeneration better or worse. Good question. Yes, ma'am. Great question. So it depends on your prescription. I would say many prescriptions, after cataract surgery, we can make you glasses free for the distance, but then we only can put one prescription in the eye, right? So we would either put in your distance or your up close. The eye still cannot adjust, so you may still need reading glasses after surgery. However, they do make special lens implants that have zones in them, a zone for the distance and a zone for up close. So if you really hate glasses, that's an option too. Yeah. Yes, ma'am. You stole one of my questions. Everyone's going to get it right. No, that's a great question. So it hasn't been shown that using screens damages the retina or causes glaucoma. But it seems, a lot of people wonder, they're like, but after I, look at a screen for a long time, my eyes feel really tired, right? So some of that is that, on an iPhone or something, the print is so tiny, you're often like really straining to look at it. Or the other option is when we look at screens, we actually naturally don't blink as much. And then our eyes get very dried out, and then you start to get that burning or feeling like something's in your eye sensation. But no, we don't know yet. They haven't done really good studies, so maybe the answer will be different in the future. But as far as we know now, it doesn't cause those things. Yeah, why do they say that? Yeah. So the reason for that is that there's probably 300 different things that can cause a headache, right? So we don't know that it's from the eyes. But if you're straining to read, for instance, like let's say you need reading glasses, but you're not wearing them, and you're really straining a lot, that can give you a headache. Or rarely if you had high pressure inside the brain, that's actually something we could see in the eyes. But that would be very rare. That's not what normally causes headaches. But sometimes neurologists send us patients to check for that. Yeah. Yep, great question. So there are vitamins for macular degeneration. Usually we use it in early or moderate macular degeneration. For other conditions, we haven't shown that vitamins do a whole lot. That doesn't mean they're bad, but it's hard to prove, right? We can't, put hundreds of people on one room and say you can only eat this for a few years and then see what happens, right? So it's very hard to do those studies, so we don't always know. But what there has been a study on is macular degeneration and vitamins. Yeah, so for macular degeneration, for instance, controlling blood pressure, not smoking, and wearing sunglasses and bright light. Yep. Good question. So there's a big range of time when you can remove a cataract. Usually it's not something where you're like, oh my gosh, we have to take this out tomorrow. But if you wait 10 years past when it's kind of ripe and ready to come out, it becomes very hard. It's like a rock. So it makes it a little hard for me, but that's okay. We can still do it. But essentially, it's like a rock inside the eye. So we have to use a little bit more energy to get it out because we use an ultrasound to kind of break it up into tiny pieces and get it out. So if it's very hard, we have to use more energy, which makes your recovery a little bit longer. Your vision won't be clear for a few weeks after surgery if you have a large cataract, but we can always get it out somehow. All right. Anything else? Okay, so I have some questions for you now, but don't worry, it's not graded. Okay, so which of the eye diseases we talked about before causes vision loss off to the sides and is associated with high pressure inside the eye? You can raise your hand if you have an idea. Yes, ma'am. Yes, ma'am, you got it. Okay, so we have a little gift for you. All right, this is for you for being brave and right. Okay, which of these is not a risk factor for macular degeneration? A, television and computer screen time. B, smoking. C, family history. Or D, sunlight. Yeah. That's right, yeah. At least not that we know of yet. Hopefully not. Okay, this is for you. That it can give you a headache, yes ma'am. Okay, so that's right. And then lastly, how do we treat cataracts? Is it one of those eye injections? Are they not treatable? Do we use eye drops? Or do we do surgery that's sometimes assisted by a laser? Yeah. What'd you say? Yes, ma'am. That's right. Surgery assisted by a laser. Yes. All right. Great work. Sure. Okay, and then lastly, I just wanted to tell you a little bit about us. There's lots of great ophthalmologists out there in Northern Virginia, so you're lucky that you're in a good place. There's a lot of good doctors. But our practice does comprehensive ophthalmology, so basically all the things we talked about, we do at our practice. And we also are a cornea subspecialty practice. So the cornea is the front layer of the eye, and there are some very specific conditions you can get of the cornea, so we specialize in that as well. We're a team of both ophthalmologists and optometrists. We all work together. And we have 3 locations. We're in Tysons, Route 7 and International Drive, just across the street from the mall. We're in Arlington, adjacent to Virginia Hospital Center, which is probably the closest location to here. And then we're also in Rockville. So we have 3 spots we could see you, and we're, of course, happy to see you at any time. All right. Thank you so much. If you have any other questions, feel free to chat with me afterwards. Thank you.